Now, when we ask about what is the seriousness of the condition, what we need to know here, we need to classify the headache, history and physical examination we have to do. We have to understand the criteria for low-risk patients whom we can send home with some medicine without much investigation. And definitely we have to evaluate the red flags. Why? Because if there is a red flag sign there, you have to send this patient urgently or non-urgently for neuroimaging or lumbar puncture or some blood test, etc. You can't really send patient home safely saying that, okay, just take this medicine and you will be fine. So this elicitation of this red flag signs, very, very important. Because most of the headache, when we talk about classification, now, can you tell me how we classify headache in very short? Gauri, you take this question and you can answer as well after taking the questions from there.
So the question thrown is about classification of headache, right? So I'm just looking at anybody answering it.
So if nobody has answered yet, can you tell me how you classify the headache?
Now, classification can be based on the, the acuteness or the chronicness of the headache. Classification can also be based on the type of headache. So if it has to be migraine, primary migrainous kind of headache versus a secondary headache, which is because of.
Exactly. So this is the baseline where we use this word primary and secondary headache. Primary headaches, they are more common compared to secondary headaches, which includes mainly migraine, then tension type headache, cluster headache. They have now again another terminology like trigeminal, autonomic, cephalgia, which includes few things, including cluster headache and some other things like headache associated with sexual activity, cervicogenic headache, sinusitis, all this. But the main, not sinusitis. Sinusitis come under the secondary headache. Secondary headache is a headache which is due to something. Now, interestingly, though this class of headache is not as big as primary headache, but we have to find out whether somebody has got this secondary headache, because these are the patients which pose more challenge to us. And these are the patients who might need an urgent or non-urgent admission or investigation. So this group, when you are just encountering that something is causing headache, the problem is this second group, secondary headache, is not that the patient will just present with headache. They might have other symptoms which are more prominent. Maybe sometimes just present with vomiting, sometimes present with some temporal area throbbing pain, or sometimes patients may present with some eye symptom. So you have to be very careful that whether this headache is associated with something.